too high, then the chances are you are under the condition of hypertension or high blood pressure. I am not having the best when it comes to the terminologies to use from the side of science, so that's why we do have a guest this morning joining us to discuss more of the hypertension management. This is Good Morning Uganda Extra. Thank you very much for joining us here on UBC, the extension of UBC's Good Morning Uganda. My guest this morning is Dr. Rogers Owori. Now, Dr. Rogers Owori is a medical officer at the Uganda Heart Institute, and he does join us here in studios. Good morning, Doctor.
Yes, good morning, Mr. Paul.
Starting it off from hypertension, I've done a simple explanation, but let's hear it from the side of the medics or from the medical world. What is hypertension, if you are to break it down for us?
Okay, thank you so much. So just before I dive into that, let me bring in my the greetings from Uganda Heart Institute.
Okay.
We are very humbled to be hosted on UBC. Yes, so coming to your question, I'm going to give a bit of a preamble on what hypertension is. Yes, so let's just begin by talking about blood pressure per se.
Okay.
And I will also use analogies to try to explain it. So blood pressure is basically the force with which your blood pushes against your arteries. So just like you hear water pressure in your taps, the other one is water, this is blood. So we are just substituting water with blood. And the other side we have the taps or the pipes that water flows through, and here we are saying that these are now our arteries. In simple terms.
Okay.
Yeah. So now, just like in your homes or in your houses, you don't want the water pressure to be very high, and you don't want it to be very low, because I mean, you won't get what you want to do your activities at home. The same thing with the body. We don't want the blood pressure to be very high, and we don't want it to be very low. So that brings me to hypertension. So basically, when we are talking about hypertension or high blood pressure, so hypertension is basically the medical term that we use, but you can just say high blood pressure. So there are various categories that we can use, or the guidelines that have been put across to define for us hypertension.
Okay.
However, the most simplified one is GNSC 7, which just looks at a figure that is anything above 140/90 millimeters of mercury. Then you know that you have high blood pressure or hypertension.
Doctor, quickly, are you specialized in hypertension per se as a doctor, or that is something that you do in your role? Just to help us understand from the medical side of things anyways, is there a special kind of doctor who is responsible for hypertension, or anyone?
Yeah, so depending on how you look at it. However, hypertension falls under heart diseases.
Okay.
Yes, so when you are being seen by a doctor who is familiar with heart diseases or a cardiologist, then you're in good hands. However, there is also a caveat. The reason why, what brings us even to this entire program to try to create awareness about hypertension is because it causes other complications. And those complications can affect either the kidney, whereby now you need to see a nephrologist. It can affect the brain, where you need to see a neurologist. So it can affect quite a number of organs in the body. But if it is just basic, then basically cardiologist is best fit.
Okay, and let's look into the primary risk factors for hypertension in this current generation of ours.
Yes, so there are a number of risk factors, and some of them are genetic, meaning that hypertension flows in your family line or lineage. However, there are also lifestyle factors. For example, our habits like smoking, higher consumption of alcohol, being physically inactive. Those are some of them, but there are also other conditions that can actually lead to hypertension, and some of those are kidney diseases. So the thing with the kidney disease, it can cause hypertension, and also hypertension can cause kidney disease. So those are some of the risk factors that you can tease out real quick.
Yeah. And well, besides that, you know, you've mentioned something of that nature, and one may wonder, how then can I be able to identify first sight that I'm dealing with hypertension? But then also, is hypertension, should we consider hypertension a heart disease, or is it a condition?
Okay. So first of all, how can I know that I'm dealing with hypertension?
Yes.
We are emphasizing this, and let's take it seriously as the public, because the prevalence of hypertension is going up every now and then, causing higher morbidity and mortalities. So what we are saying, let's begin by knowing what our numbers are, what our figures are, because we can't deal with what we don't know to start with. Let's first know what our numbers are. Then once we know, we can now know how to tackle it. At what level? Have we already gotten there, or we haven't gotten there? If we have gotten there, have we already gotten the complications of hypertension, or we haven't gotten? If we've gotten the complications of hypertension, then how can we tackle it? So that is the topic, surely. And when you're talking about it, so ideally it's a heart disease. Yes, so basically, primarily it's a heart disease, and it's one of those risk factors for other heart disease complications.
Okay.
Yes.
Dr. Awori, I also want to understand, you've talked about the prevalence of the hypertension as a heart disease. Under which age bracket is it most dominant?
Okay, so with regards to the prevalence and the age category,
Okay.
so we used to know that hypertension is the disease for the elderly or a bit aged population, but that is changing. We are seeing hypertension in 30s, 40s. So ideally now 40s to 50s, we are seeing a lot of hypertension. And again, that could be stemming from some of the risk factors that we're asking about. And I think one of those that I didn't talk about was the stressful events that are going on, trying to, meet, activities of daily living, trying to earn income here and there, and yeah, those are some of the things. So that is the age bracket. It is shifting. Back in the days, it used to be above 50s, 60s. That's when we have hypertension. It's now shifting. We are seeing it in mid-30s, mid-40s.
Let's look into blood pressure. Now today, even the young ones, like you've mentioned, are also having this kind of situation. But for clarity's sake, what is the normal blood pressure for a human being? And at what rate does one know that I'm going overboard? Now it is hypertension.
Okay. All right. So it's a range.
Okay.
So when we are talking about blood pressure, we are looking at two values or two figures. That is the systolic and the diastolic. So the systolic is written as the numerator, and the diastolic is written as the denominator.
What is that in normal, in
normal
layman's
figures,
language?
we want it, remember I said it shouldn't be very low, it shouldn't be very high. So the systolic, we want it above 90, but less than 120. That is the top one.
So it shouldn't exceed 120.
It shouldn't exceed 120, ideally. Then the lower one, we want it between 60 and less than 90. That is the lower one. So if you ask me in simple terms, we want it between 90, or anything above 90 over 60 to anything less than 120 over less than 90.
Okay.
Yes.
And doctor, let's talk the diagnosis bit of things. What is the diagnostic criteria for hypertension, and what do you consider from the side of the medics?
Okay. So again, so I talked about the normal. However, anything between 120 to less than 140, we say that you're at risk. You're pre-hypertensive. So we advise you, please modify your lifestyle. Do this, reduce on the salt intake, reduce on this and that. Okay? You're pre-hypertensive. Anything above 140 over 90, then we say you are hypertensive. However, it doesn't mean that when we say that you are hypertensive at 140/90, we are starting you on drugs ASAP. No, that is not the case. So again, we tailor it. First of all, it shouldn't be one reading. We want to take an average, at least taken at a different time interval. Then if it is persistently above 140/90, then we now look at other things. For example, other risk factors for heart disease, for cardiovascular disease. If you have them, then we tailor your management depending on your risk factors. So it is individual management, not as general. However, when we are categorizing, you being hypertensive, we take anything above 140/90.
And doctor, I also want to know how, to what level does our lifestyle affect our blood pressure, and which kind of lifestyles are we living that are putting us at a risk of hypertension?
Okay, thank you so much. So many the sedentary lifestyle, we are going for the junk. When we were growing up, some of us, meat was for the rich. And when you eat meat, you would be very excited about it.
Having it on Sunday or on public holidays.
Exactly. And you'd get tired of the greens. But now we are recommending that, no, let the greens be more. The red meat, let's limit it. Okay? Let it not be as frequent. Now, actually, those who are rich health-wise are the ones who are eating more of the greens, eating more of the fruits, people who are active. And with the physical activity, it also again depends on the person. Yeah, it should again be tailored according to the patient that you're dealing with. Because there are patients who cannot do intense physical activity. However, what the guideline actually says is just 150 minutes of physical activity, however, spread throughout the week. So if you say that I'm doing 30 minutes, that is good. But our point is, we want you to break a sweat. Whatsoever activity that you're doing, please try to break a sweat. Because as you're breaking the sweat, the vessels are opening up, there's good blood flow and nourishment and things like that. So that's why we're encouraging that you break a sweat as you're doing your physical activity, and spread it all over. Don't just say that, okay, the guideline recommends 150 minutes a week, let me do it on Monday. Then I will again do it next week on Monday. No, that's not what we are saying. We are saying try to spread it. If you can do it, for example, Monday, then you do Wednesday, Thursday, like that. That is very good for the body.
Okay. And one may wonder as well, how often should blood pressure be measured? And if at all you do not have the capacities of heading to the hospitals for free services, what are the best methods to use?
Okay. So currently, we are so much recommending serial blood pressure measurements that are done at home. Because these blood pressure machines are actually not that very expensive as such. They're actually affordable. So if you can get one for yourself, well and good, you can measure yourself from home. It would be better if you measure it early morning when you've just woken up, and later on in the night when you're going to sleep. However, again, like I said, these are tailored depending on the patient. There's a patient who, for example, has very high blood pressures, and you've put them on medicine, and you want to monitor how they are doing. You can say, okay, do it 6 hourly in the next 24 hours, then begin doing it twice daily, or then daily. So it depends. However, if you don't have that disease, it's just good to know your numbers. Then you say, okay, this week, this was my number. Next week, let me try to check it up. Yeah. So
you mentioned something about the family background and the family history. How does it, to what extent does it play in hypertension development in one's body? Actually,
it plays a very big role. If you have a family history of hypertension, that is first degree, we are talking about parents, we are talking about siblings and aunties and those relatives. It plays a very big role. So what we are recommending is, if you already know you have that a family history of high blood pressure in your family, then you begin the prevention earlier on. And these are the lifestyle modifications that we are talking about. Yeah.
And when we do return after the break, we are going to have our focus and attention on treatment and management of hypertension, because it's quite important that if at all you're having this as a heart disease, or if at all you've failed to deal with hypertension, then how best can you go? And if at all you're past the range of 120, 140, how best can you start your treatment, and where can you get that treatment? Well, that is what we're going to be focusing on after the break. So stick around. This is Good Morning Uganda Extra.
Live from UBC Studios in Kampala, this is Good Morning Uganda Extra.
The Ministry of Health informs the general public that there are some cases of Mpox detected in Uganda. The ministry, working with partners and affected district local governments, are doing their best to contain the situation. The signs and symptoms of Mpox are body rash, fever, general body weakness, headache, sore throat, nasal congestion or cough, and swollen lymph nodes. You can prevent yourself from getting infected with Mpox by avoiding close contact with people who have been confirmed to have Mpox or who have signs and symptoms of Mpox. Avoiding touching or sharing personal items like beddings, eating utensils, phones, or other belongings of a person who has the signs and symptoms of Mpox. Avoiding contact, including eating, with all wild animals, alive or dead, especially those known to carry the virus, such as rodents and monkeys, and those that appear sick or have been found dead. Getting vaccinated if you're among those who have been identified to be at high risk of Mpox infection. Mpox is treatable and usually goes away after 2 to 4 weeks. However, it can be severe, causing even death, especially among children, pregnant women, and those with other health conditions. For more information and support, contact your nearest health worker. Call the Ministry of Health's toll-free line on 0800 100 066 or send a free SMS to YouReport on 8500.
The East Africa UK Tourism and Cultural Expo 2024 is here, happening on 8th and 9th of November 2024 under the theme Enhancing Tourism as Engine for Social and Economic Transformation on the sidelines of WTM London at the Rembrandt Hotel, 11th Thalo, PI South Kensington, London, SW7 2RS, United Kingdom. For tickets, exhibitors will pay £1,000 and participants will pay £300. For more information, call +256 787 096 100 or +254 795 806 969. Visit www.eauktourismexpo.com to register.
Juko.
Yo.
Check the shopping, man. What's your secret?
Haven't you heard of the Parish Development Model PDM?
Yes, I did, but I thought it was just a talk.
No, Sebatia. It is real. I and a few friends together formed a circle, accessed money from the PDM, invested in a portrait project, and now things are moving.
Juko. I thought I was one of your friends.
You are.
But you left me behind.
I didn't leave you in poverty. What you do, just visit your LC2 chairperson and your parish chief and start the process of economic transformation. Just like that. The Parish Development Model is an initiative from the government of Uganda through the Ministry of Local Government designed to transform all lives of Ugandans for the better. PDM, my parish, my development, my life.
Live from UBC Studios in Kampala, this is Good Morning Uganda Extra.
Well, Good Morning Uganda Extra now returns with more conversations in regards to the modifications and also trying to look into the prevention and treatment for hypertension. Dr. Awori is still with us right from the Uganda Heart Institute, and he's in studio with us to give us more of the hypertension management, looking at lifestyle and the prevention of any risks attached to the same. Now, Doctor, let's look into the lifestyle modifications. It is quite beautiful to see lately that many urban dwellers have turned their attention to heading to the gyms and try to watch on their fitness. Many fitness coaches are also on social media encouraging many Ugandans to adapt to the lifestyle and having a look at their weight journey and also looking at so many things really. But on the side of the lifestyle modifications, where do we start from?
Okay, yeah, thank you so much. So just to top up on that, nutritionists are also doing the, you know, they're advocating for the same also on their different platforms.
Okay.
Yeah. So, well, let's begin with our habits. For example, smoking. Smoking is really not good for our health and is one of those risk factors for high blood pressure or hypertension and its complications. Well, it is good to start with reducing it. However, the ultimate goal would be to stop smoking. Then when it comes to alcohol consumption, too much alcohol consumption is not good. And again, it increases high blood pressure and its complication and the other associated risk factors, including dyslipidemia, that is weight gain and the like. So also reducing on alcohol consumption is also very good for your health. Then when it comes to physical inactivity, yeah, I can attest to that as many city dwellers are actually doing gym and others are doing road work, they are jogging and stuff like that, myself inclusive. When I'm doing some bit of jogging, I meet very many people, they are embracing that trend, which is very good for their health. As you're tackling the weight, you're also at the same time tackling high blood pressure. As your weight is improving, your blood pressure is also improving, as so are other body organs. Then the other point that is very significant to make a mention of is salt intake. Yeah, we tend to forget about it. We tend to use raw salt as much as we want, liberally, which is not very good for us because like we know, just like if you put that salt outside there, it's going to attract a lot of water. The same thing in the body. Eat a lot of salt, attracts a lot of water, increases your blood volume, henceforth increasing your blood pressure. So what we are saying, we are not saying that stop eating salt, but we are saying that reduce, limit on the salt intake. And mainly, once it has been put in the sauce or in food, it's not worthwhile adding raw salt onto your food sources. Thank you.
Well, Doctor, now we turn our attentions on the other primary options of treating hypertension besides the lifestyle modifications.
Yes, so there are many options for treating high blood pressure or hypertension. Again, it depends on the patient's numbers or the figures that they have.
Okay.
Then secondly, so we tailor the management depending on the patient who is right before you. However, what is of a concern to us as the medics is adherence to this treatment. Let me give an example. Oftentimes, depending on who is managing you, someone may decide to start low, up titrating, others may start to high, then they be monitoring you closely and they begin down titrating while monitoring your blood pressure. Dependingly. So someone can start with you on 1 molecule of antihypertensive medicine, low dose. If the figures are not improving, then increases it to higher dose. If it's not improving, adds on the other. That is okay. However, literature has it that if you combine it's actually better. So you're better off with combining different molecules, but at a low dose, because different molecules tackle different mechanisms that lead to high blood pressure.
Speaking of molecules, break it down for my viewer who is not into the science world.
Yeah, so I'm basically just meaning that drugs for treating high blood pressure.
Oh, okay.
Yeah, that's basically what I'm meaning. Yeah, however, what is very important is adherence. So what we tend to see is once patients have been started on high blood pressure medicines and their figures improve, then they self-withdraw themselves from the medicine. Forgetting that oftentimes it's actually the medicine that is giving you the results that you want. Okay. So when you get off the medicine, it reverts. Yeah, and dependingly, you never know how it may come.
Because I wanted to ask on the issue of the medications. Are there any side effects if I told you on the drugs?
Yeah. Yeah, so again, medicines come differently. We react to them differently. I always give this scenario to my patients that I may give you paracetamol for your headache and it works for you. Then I take the same paracetamol for my headache and it doesn't work. So again, we respond differently depending on our body physiology. So every drug technically has side effects, and this is one of the things that we emphasize. For example, let me say if I'm giving a patient high blood pressure medicine like, for example, amlodipine, I may tell you that, okay, be wary, it may cause you lower limb swelling, okay? Be wary. If it comes up, don't think it is this and that, it could be that drug. So the best thing is you report back and we see. Depending on the severity, I may choose to adjust or give a different high blood pressure medicines, because we have quite a number of high blood pressure medicines and we tailor them depending on the patient profile. Which one works for you best, which one causes you the side effects, we withdraw that and we improve on your blood pressure numbers.
Well, I do have a comment here. He did not leave his name, but I think he says that, good morning, Uganda. I'm Dennis. Oh, he did. I'm Dennis from Western Uganda. He says his son is 27 years old, and last month his pressure was at 113, and then he uses some terms here that I think you will definitely know more. And then the dia, I think that is for the
story.
Yeah, I think was at 78, and the pulse per minute was 152. And he asks for your advice.
Okay. So again, this from the numbers that he has given us, that is basically normal blood pressure. Okay. However, the heart rate is out of range.
The 152.
Yeah, 152.
What causes that at times? 27.
27. Yeah, so ideally for an adult, we expect your heart rate to be in between 60 to 100.
So 152
so
per
when
minute
it is 152, that is out of range. Now, there are quite a number of things that can cause it. There are quite a number of things depending on the diseases of the heart. It could be anxiety. There are quite a number of things. So what is important is, first of all, you can't base on one value. It's good to repeat these vitals or these values, one. Then two, it is also good for all patients who have deranged heart rate. We always do an ECG for them, electrocardiogram. So electrocardiogram or ECG is basically, it's basically a tracing of our electric activities of the heart. So what it tells us, what is causing the abnormality of the heart rate. And it can also tell us other things, but that is to begin with. So an ECG is very recommended for this patient and a way forward to be sought based on that. The other thing is, I think this would be a patient who would be reviewed by a cardiologist or in a facility that has that capability, and the patient is managed fast forward.
From our conversations, I have come to think of it in a way that we are likely not to have hypertension completely out of the body system, but it can only be managed or treated for some time. But again, I need to ask though, are there any emerging treatment technologies that are coming up from the world of medicine and technology to ensure that we completely deal with this condition?
Okay, let me begin from the first bit of the statement that you made.
Okay.
So one, let's first know this, that once you're diagnosed with hypertension, you're hypertensive.
Okay.
Just have that at the back of your mind. Once you've been confirmed.
Should it worry me?
Yes, it should, dependingly.
Okay.
I'm getting there. So should it be confirmed that you have hypertension, you have to know that that is your history now. There is nothing like I had hypertension and it cured because of this and this. Of course, there are other circumstances. For example, if the issue was because of the kidneys and that was sorted, then it can always revert. But still in your history, for example, for me as a doctor, when I'm taking your history, definitely you're going to tell me I had hypertension and it was because of this and this was done. So let's first get this clear, that hypertension is a chronic disease, okay? And our target or our goal is to achieve control. Once you've been diagnosed with hypertension, now we want it controlled. So what a layperson who will say that, oh, my figures are now good, I've been cured. First we say, okay, you're now controlled. Yes. So as you were asking, if you've been diagnosed with hypertension and you're hypertensive, should you be worried? Yes. Because dependingly now, if you don't adjust your lifestyle accordingly, if you're not adherent to your medicines accordingly, depending on the instructions given to you by the medical provider that you're seeking help from, then it will be a problem. Actually, let me even pass this also across, that hypertension, and this is what I tend to say, that people ask you, what are the signs and symptoms of hypertension? How will I know that I'm actually hypertensive? And that's where I go back the other side, where I was saying that. Let's know our numbers. Because ideally, the first signs and symptoms of hypertension is actually no signs and symptoms. So you're feeling very, very okay, you're doing your activities normally, but your blood pressure is actually shooting. So we want you to know that number. So the time when you say that I have these signs and symptoms, you're actually now being affected. You're having the complications of hypertension. For example, if you have chest pain, we want to know, oh, isn't this not a heart attack? This heart attack could be traced back as a complication of what? Hypertension. Doctor, I can't speak, I'm paralyzed. Oh, have you developed stroke? This could be because of hypertension. I'm no longer passing urine normally. The flow is very poor. My urine output is very poor. We are saying, oh, you are hypertensive though. Have you been adherent? I think the hypertension is now affecting your kidneys. So that's what we are saying. Let's not wait for the signs and symptoms. Let's just know our numbers.
And doctor, let's look into how best medical practitioners and medical centers can be of help to people dealing with hypertension. And also at the Uganda Heart Institute, what initiatives have you been coming up with and what have you been doing to help patients dealing with hypertension?
Okay. One, I'm going to begin with the Uganda Heart Institute.
Okay.
I think they have really put out a lot of efforts to combat most of these heart diseases. And one of them is through outreaches.
Okay.
Health camps, health outreaches. I can't count how many we have in a year. There are very many. And we keep going in those fat-rich places, those rural areas, trying to reach out to people, trying to check their blood pressures. And I'm telling you, you'll be surprised the numbers we get there. They are really alarming. And someone tells you, I feel nothing, I'm okay. I'm doing my daily activity. I can just quote one where we had 270 something. That is a systolic. And this lady is telling you, I'm okay, I'm not feeling anything. But that is not good, because it is affecting you without you knowing. By the time you know, it's the complication. So in terms of that, during those outreaches, we do this screening for high blood pressure, we do those ECGs, we do the echoes and stuff like that. And for patients who need sophisticated health care, we always refer them to the institute to have them managed. Away from that, the institute itself has equipped itself. It has a lot of what we used to just read in books, what we watch in movies. We actually have those equipments at the institute. And patients are being helped, patients are being worked on. So those are all initiatives that the institute is putting across. And if you come on a daily, just on a routine daily, on a weekday at Heart Institute, you will really see numbers. And people from different parts of the country. And these, I believe this is coming from the efforts that we are making to reach out to the entire part of the country.
Okay, and Doctor, let's also look into education of this topic of hypertension, people empowerment, because this is you mentioned the chronic disease, and anyone at any one moment can easily be diagnosed, and it quickly starts their own history of hypertension, not only for themselves but also for their family lineage. But looking into that, what should we do now? Now this is from a societal perspective. Societal perspective.
Let's all try to know our numbers. Let's try to know what our numbers are like. And you see, the beauty with blood pressure screening, actually, oftentimes they are free. In many places that you go to, they are free. You can walk in a health facility and you're like, oh, please, help me check my blood pressure. They're actually free. So what we are emphasizing on, let's know our numbers. And if our numbers are out of range, let's involve the medical practitioners to help us out. And also, once you're in touch with a doctor, a cardiologist, whoever is managing you, also keep track. Don't, if they give you an appointment, don't get lost to follow up to these appointments. Because you never know. Oftentimes, most of the admissions are either because the patient has been lost to follow up, or the patient has been unadherent. And the admission will be because has gotten a complication. And that's when they remember to come. So let's know what the complications are, let's know what our numbers are, and let's work accordingly.
Someone is asking here, does stress contribute to hypertension?
Yeah, sure.
This is Yoko Sofat from Kapchora.
Yeah, sure. And I think I mentioned about that more so to the why we think the trend is shifting from the elderly so much to now the middle-aged. We think it's because of the stressful activities. People are trying hard to earn a living. And because of that, here and there, stress either at work or at home is affecting them. But the beauty with the one that so much is caused with stress is, once you get proper stress management, it always reverts. So that is the other bit. But it is also not unlikely for it to carry on and manage. Okay.
And lastly, what message would you like to convey to those facing or having hypertension currently, and your parting shots as well, Doctor?
Okay. Thank you so much again. Thank you so much to our viewers. Thank you for sparing time to watch us. And I'm going to say this, to those who don't know already whether they're hypertensive or not, let's struggle to know our numbers. And to those who are already hypertensive and are on treatment, please be adherent on your treatment. Don't get lost to follow up. Attend to your appointments when due. And also know that the more you have your blood pressure controlled, the more you have a reduced risk for having complications of hypertension and heart disease in general. Also, we bring our greetings from Uganda Heart Institute. From wherever you are, you can always pass by for checkups, and we are always ready to attend to you. Thank you so much.
Oh, that is Dr. Roger Sowori, medical officer at the Uganda Heart Institute. He has been breaking it down for us in the matters to do with hypertension management, prevention, and the lifestyle. So the lifestyle you choose can also greatly affect your blood pressure. So it is something that we need to be really, really very sensitive. It's something that we really need to focus on because it's a sensitive topic. This is a chronic disease, and meaning we need to play our part as well to ensure that we are not in any one moment caught up by hypertension or high blood pressure. Well, that does it for our conversation here on Good Morning Uganda Extra. Since the time we started at 6:30 a.m. with myself, Olive Monica Najuma, and Ruben Pima Chibirango with the sports updates. Till tomorrow at 6:30 a.m. Thank you very much for sticking around with us. Have a good day.
Live from UBC Studios in Kampala. This is Good Morning Uganda Extra.